Hey everybody, welcome to this episode for CyberMD. Today we will be discussing Wiggers Diagram and cardiac physiology for the USMLE STEP 1 exam. Wiggers Diagram is a visual representation of the electrical and mechanical activity of the heart, and it is a crucial concept for understanding cardiac physiology. Let's quickly review the basic anatomy and physiology of the heart. The heart is a muscular organ that pumps blood throughout the body. It is divided into four chambers: the right atrium, right ventricle, left atrium, and left ventricle. Blood flows into the right atrium and is then pumped into the right ventricle, which then pumps it to the lungs for oxygenation. Oxygenated blood then flows into the left atrium and is pumped into the left ventricle, which then pumps it to the rest of the body. Again, Wiggers diagram is a representation of the electrical and mechanical activity of the heart. It shows the electrical impulses that cause the heart to contract and pump blood, as well as the pressure and volume changes that occur in the different chambers of the heart. The ECG portion of Wiggers diagram represents the electrical impulses that cause the heart to contract. The P wave represents the electrical impulse that causes the atria to contract, and the QRS complex represents the electrical impulse that causes the ventricles to contract. The T wave represents the electrical impulse that causes the atria to repolarize. The right atrial pressure curve, ventricular volume, and heart sounds are all used to monitor the mechanical activity of the heart. The right atrial pressure curve shows the pressure changes in the right atrium, and the ventricular volume shows the volume changes in the ventricles. The heart sounds are used to listen for any abnormal sounds that may indicate a problem with the heart. The left atrial pressure and left ventricular pressure are used to monitor the pressure changes in the left atrium and left ventricle, respectively. The aortic pressure is used to monitor the pressure in the aorta, which is the main blood vessel that carries oxygenated blood to the rest of the body. It is important to note that the P wave and QRS complex should have specific shapes and duration. If the shape or duration of these waves is abnormal, it may indicate a problem with the electrical activity of the heart, such as an arrhythmia. These are all general observations of Wiggers diagram. However, to really obtain a complete understanding of the diagram, you should look at what is happening at each vertical line, as well as when any horizontal line has a change. First, you should notice the P wave of the ECG tracing, where the atria receive a signal to begin contraction. This is followed by an increase in atrial pressure, as well as an increase in ventricular volume and pressure. This makes sense as the blood is being forced from the atria into the ventricle. Then you will encounter the isovolumetric contraction phase, in which the mitral valve and aortic valves are both closed. Realize that this is occurring immediately following the start of the QRS complex. The ventricular volume stays the same because this is isovolumetric contraction. There is a massive rise in ventricular pressure until the aortic valve opens, at which point the aortic pressure increases, ejection occurs, and the first heart sound is heard. During ejection, the ventricular volume drops, and the T wave, which represents atrial repolarization on the ECG tracing, occurs. Following ejection, the aortic valve closes, creating the second heart sound, which is followed by a brief period of isovolumetric relaxation before the mitral valve reopens to allow for rapid inflow during diastole. What I've just described is the major events of the Wiggers diagram that correlate with a single heartbeat. Understand how each change on the diagram relates to other changes to further solidify your understanding of cardiac physiology. In conclusion, Wiggers diagram is a visual representation of the electrical and mechanical activity of the heart and is essential for understanding cardiac physiology. It is used to understand, diagnose, and monitor cardiac conditions and is a crucial concept for the USMLE STEP 1 exam. Thanks for watching, and be sure to subscribe to our content.